Hello, and thank you all for joining us today. Today we're going to talk about what living with dementia may look like for someone with dementia and their caregivers. Our topic today is on living with Alzheimer's disease and related dementias, ADRD. Information here can relate to experiences of the person living with dementia and for those who care for them. We will be talking about the following topics related to living with dementia: what to expect when caring for a person living with dementia, meeting the emotional needs of the person living with dementia, preparing for the long term, and managing caregiver stress. Dementia is a general term for a decline in mental ability that interferes with daily life. A person with dementia may have memory loss and a decreased ability to think. There are different types of dementia, which is why we usually use the term Alzheimer's disease and related dementia, or ADRD. Today we will refer to the broad term dementia. Also, we refer to the person with the condition as a person living with dementia. Learning that you or a loved one has dementia can be overwhelming. It is natural to feel uncomfortable talking about ADRD. It's okay to look for support from family and friends. Support from loved ones includes being patient and kind when someone tells you they have dementia. Hearing a dementia diagnosis, whether it's for yourself or a loved one, can be emotional and overwhelming. It's important to take things one step at a time. Talk to family and friends. Share the news when you're ready and let others support you. Create a care plan. Work with doctors and loved ones to make decisions about medical care, legal planning, and future needs. Maintain a routine. Routines help make daily life easier and reduce stress. Stay connected. Social engagement is key to brain health and emotional well-being. Early identification and treatment of dementia may make managing the condition easier. Work with your healthcare provider. Healthy behaviors may help slow cognitive decline and promote well-being. This includes getting proper sleep, activity, a healthy diet, and stopping smoking. Dementia is a chronic condition, meaning it will not go away or be cured. Dementia needs to be continually managed like other chronic health conditions such as heart diseases or diabetes. It is critical for the person living with dementia, caregivers, and loved ones to know what to expect from the disease and treatment. Ask questions and learn as much as you can from your healthcare professionals. Be mindful of changes that will happen. For example, there may be a time when changes in living arrangements are made, such as from independent to assisted living. The person living with dementia and caregivers need time to adjust to these new arrangements. Learn as much as you can to gain a better understanding of dementia. This is what you are doing now at this workshop. Knowing about the decision allows you to make informed decisions. If one of your loved ones told you they were diagnosed with dementia, what would you worry about? If you were told you had dementia, what would you fear? Those emotions are understandable. A number of emotions may arise. It's important to find a healthy outlet for those emotions. Tips for helping with emotional needs that you or a loved one can do include writing down your thoughts and feelings, encouraging each other to talk about how you feel, and together, joining an early stage support group with other individuals also living in early stages of dementia. In addition to emotions around their diagnosis, people with dementia and their loved ones may have feelings about the changes in roles and responsibilities. This can include feeling left out or excluded. For example, loved ones may make future plans without you or them. Feeling like you or they are losing independence, especially when loved ones may make decisions for the person with dementia, such as when to stop driving or working. Being afraid that you or they are burdening others, especially when responsibilities you or they once had are assumed by others. Caregivers often experience high levels of stress. This can be overwhelming, but there are healthy ways to address and manage this stress. Learn what community resources are available to help you manage daily tasks and for support. For example, adult day programs, visiting nurses, and meal delivery services. What are some ways a caregiver can take care of themselves as they care for a person living with dementia? As a caregiver, taking good care of yourself is the best thing you can do for yourself and loved ones. Here are some ways to stay physically and emotionally strong. Take care of yourself. Remember to meet your needs, including managing your own health. See your healthcare team regularly. Stay active. Exercise can help relieve stress and prevent disease. You can also be active with the person that you are caring for by taking walks together, gardening, or other routine activities. Adopt healthy eating habits to ensure your body has the nutrients it needs. Make time to care for yourself, such as taking time for yourself and socializing with loved ones. Try relaxation techniques and find which ones work best for you. For example, visualization, picturing a serene and peaceful place, meditation, and breathing exercises. There are many community resources to support caregivers and their loved ones, such as your physician, nurse practitioner, and healthcare team, your local Alzheimer's Association chapter, community-based organizations, and agencies for the aging. These are just some of the resources that can support you or connect you to a place that will offer the support you need. Let's wrap things up. Today we talked about some things to expect when living with dementia or caring for someone with dementia. We also talked about emotions and challenges when dealing with dementia. Finally, we talked about the importance of self-care for the caregiver. Thank you for coming to today's workshop. We hope that you will come back and attend some of our other workshops on ADRD or on one of our other workshop topics.